Welcome to the infusion section of this video. To start, you're going to want to wash your hands and clean the area where you will be mixing and infusing your factor. Make sure your hands are completely dry, then put gloves on. Obtain supplies to mix and infuse factor. You will need your factor, normal saline, tourniquet, butterfly and syringe, alcohol, gauze, and Band-Aid. Mix the factor and draw up into a syringe. Refer to other sections for instructions on mixing factors. Set aside where it is easy to reach. So I'm removing the butterfly. I've taken the cap off the top of the saline. I am going to attach the saline to the end of the butterfly and slowly fill the butterfly tubing with normal saline. Now it is time to find a vein. The use of a tourniquet can make finding a vein easier. The tourniquet should be placed on the arm several inches above the vein that you would like to use for infusion. The tourniquet should be placed firmly on the arm so the vein pops up, but not so tight that it is uncomfortable. Placing the tourniquet may take practice. The best place to find veins are on the back of the hand, the forearm, and in the bend of the elbow. If having difficulty locating a vein, try placing a warm washcloth over the area for 5 minutes or use a commercially available hand or foot warmer. It is helpful to get used to feeling the vein with your non-dominant hand, since your dominant hand will be holding the butterfly when you are ready to stick. Once a vein has been chosen, the area should be cleansed with an alcohol pad or chlorhexidine pad in a 1.5 to 2 inch circumference of the intended insertion site. Wait for the cleanser to dry. Do not blow on or fan anything over the intended insertion site, as that can cause contamination of the area. Once the intended insertion site is dry, remove the plastic cover from the butterfly, making sure that nothing comes in contact with the needle until the needle goes into the skin. The triangular bevel of the needle should be facing up. Hold the butterfly with your dominant hand and your child's hand or arm with your non-dominant hand. Depending on how the vein is, you will insert the butterfly into the skin at a 10 to 45 degree angle. The deeper the vein, the greater the angle when inserting the needle. Insert the needle through the skin in one gentle, consistent motion. Stop inserting the needle when you see blood in the butterfly tubing or the needle is at least halfway in, whichever comes first. You may hear this referred to as a blood return. You may feel a pop when you get into the vein. Once a blood return is obtained, release the tourniquet and pull back on the syringe. Blood should freely flow back through the butterfly tubing. Begin slowly pushing the saline. If the saline is infusing easily, you may now unscrew the saline and attach the syringe with factor. I'm going to kink the tubing and remove the saline syringe. I am going to take the syringe with factor and attach it to the end of the butterfly. The factor should push easily. If you are meeting resistance, check to make sure you have released the tourniquet. If you see swelling at the infusion site or your child is complaining that the infusion is painful, you should stop infusing and remove the needle. This may mean that the factor is not going into the vein. After the factor has been infused, kink the tubing again and unscrew the factor syringe and switch to a new saline syringe. Flush with 1 ml of normal saline to ensure the patient has received the entire dose of factor. I'm going to take a gauze and place it over the insertion site and hold it with my non-dominant hand. My dominant hand is going to be used to grab the butterfly wing and remove in one steady motion, pressing down after the needle has been removed. Hold pressure over the insertion site for 1 to 2 minutes, then remove the gauze. If still bleeding, hold pressure for another 1 to 2 minutes. Once the bleeding has stopped, place a Band-Aid over the insertion site. Dispose the butterfly and syringes into a sharps container. Do not recap the needles or syringes. Log the type of factor, number of units, lot number, expiration date, and reason for infusion in the patient's infusion log. If infusing for a bleed, write where the bleed is, as well as pain, swelling, and mobility issues associated with the bleed. Some of the issues the infuser may encounter are: should you accidentally touch the needle, withdraw the factor into the syringe, remove the syringe from the butterfly, and use a new butterfly set. If you had inserted the needle all the way in and there is no blood return, slowly pull back the needle until you get a blood return, or the needle is just under the skin. Do not remove the needle, as you can redirect the needle up, down, or to either side until you are able to cannulate the vein. Stop if your child has significant pain or any swelling at the site. If this happens, remove the needle as previously described. We do not recommend that you try to stick the patient more than 3 times for any infusion. If you are having problems, please contact your care team at the Hemophilia Treatment Center.
Thank you from the staff of the Hemophilia Treatment Center at Children's National. This video was produced by the Hemophilia Association of the Capital Area through funding from the Colburn Keenan Foundation and the Innovating Worthy Projects Foundation.